I'm Dr. Rodrigo Rodriguez, Medical Director of BioCare Hospital. I have been a doctor for over 50 years, and I have dealt with a lot of health issues, many of them self-inflicted. So please follow me, contact me, but get information. We have to educate ourselves to better manage our health and lives. You can contact me through the social media of your choice and ask a question, make a comment. I promise I will answer you. This is completely free, just from my heart to yours. My dear friends, today is one more week of having a conversation between you and me. We have gone almost through a full year since last time we were celebrating holidays. 1 year has gone by. I have to say it has been a good, blessed year. And now again, it's one more week, which is the period in which you and I have this conversation. I want to thank you again for following me, for listening to me, for keeping this conversation alive. And today, because we are approaching end of the year, a change of cycle, a different time, a different era, call it the way you want, it is a fact that every year we kind of stop, reflect, retreat, and assess everything that has happened during that period of time. And then, of course, we look forward the next period. And you can call it New Year, you can call it Christmas, you can call it your birthday, you can call it the springtime and the end of winter, call it any way you want. But it is a fact that every now and then we stop to reflect and plan for the future. And in the last few programs I have been discussing about how life has changed, how in many cases it hasn't changed for the better, and what can we do to have a better future and a better performing life. And every week I think, what are we going to talk about this time? We have talked about cancer, we have talked about serious diseases, we have talked about degenerative disease, etc. And in the last few programs, I have tried to concentrate in lifestyle and what we do with our lives. Because it's important. It is very important. And I'm going to begin telling you two things. Two true stories of people very dear to me, very close to me. One is the daughter of one of the hospital's employees. Very nice, very dear person. Anyone that has come to the hospital knows her, loves her. And all of a sudden she calls me, panicky, as you can believe, telling me, Doctor, my daughter has lost her sight. Not that she's short-sighted or has a problem reading. No, she has lost her sight. Can you imagine? When you have a 30-year-old daughter that all of a sudden goes blind? And of course, it's very puzzling. Because unless you have gone through it, you don't have the faintest idea of what's going on. It's like somebody shutting off the light. As soon as this happened, she was taken to the closest doctor. They started looking at her and they said, well, this is the beginning of a multiple sclerosis. She called me and she says, Doctor, I think it's multiple sclerosis. I already talked to her doctors and they're going to begin medication. And I said, please, 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 listen to me. No matter what you do, no matter what they prescribe, multiple sclerosis is a disease that's very connected with chronic inflammation. So if we don't do anything about inflammation, whatever you do is going to be short-lived and from my personal point of view, questionable in terms of good results. I said, you have to bring her to the hospital. We have to start immediately with an absolutely anti-inflammatory regime, diet, enemas, oxygen, everything. We have to get all this going. If we don't do it, things are not going to work the way we want them. She did. She came to the hospital, and then everything started to improve. Praise God, everything started working very well. Her sight came back in short time. She started with all the medication that was prescribed, but she began her program, her anti-inflammatory path. And as she did, she started losing weight. She was obviously overweight. She started losing weight, looking better, functioning better. One thing brought the other. Once she started feeling that she was improving in her health, well, then she started getting more physically active. And then she started jogging and walking and doing things. And always, one meal after another, looking, thinking at what she was going to eat. Very careful. Well, we have passed already more than a year's time. She is very well. There are no symptoms whatsoever. She was proposed a number of therapies that, of course, were with a lot of side effects. So her doctors always told her, well, if you start this, this might happen. If you do that, the other can happen. But you're doing fine. Let's keep on going. If we don't need to do it, we can keep it for later on. And months went by, and nothing was needed. Approaching Christmas, she comes to see me, and she says, Doctor, I want to thank you. I want to thank you for changing the way I lived and the way I saw everything. I'm actually feeling not good, but great, doing very well. I'm going to Europe with family and friends, and I'm going to have a long trip that I thought I would never do once I got my diagnosis. She says, and let me tell you something, and that's why I want to thank you. Because the first day you talked to me, the first day you explained me about inflammation and about what had to be done, it immediately clicked in my head that you were right. That it was up to me to change the way I did, not up to the doctors. It was up to me to change my life for better. There was no other one responsible, not my mother, not my doctors, not my friends. It was only me who could make this, who could really make this happen. And it happened. She said, I just had, before I do my trip to Europe and everything, I went to see my doctors. And you know what? All my doctors told me, of course you can go, of course, enjoy that trip. We're so happy for you. But they were very good because they told me, we are amazed because of your success. And they were honest enough to say, I don't think we could have accomplished all this with medication. It is the change of your metabolic activity. It was the absolute defeat of inflammation what has made the miracle. And of course, as she said it, there was only one person that could do it. And that is herself. That is yourself. There's nobody on earth that can make you do what you have to do. It is you that has to say, I have to make these changes. And it's not a matter of oh, I'm going to go on this diet, or I'm going to reduce this, I'm going to eat less of that. No, I have to switch. We're going on this road, and it's bumpy, and it's not nice, and it has a lot of problems. Well, why don't I just switch the path? Because on this other road, it's going to be a lot easier, it's going to be smooth, it's going to be fantastic. It has a very nice view. Let's switch. Don't try to go around the potholes or around the stones or around the problems. Just switch. Change for better. And when she was thanking me, I told her, I want to thank you because you're proving that everything that I have said and done for many years is absolute true. That you don't have to go anywhere else but to your own self to change your health for better. And that's what we do at BioCare. That's what we have been doing for many years. That's what I have learned from many researchers in Europe, in Asia, in America, that have been talking about this for years and years and years, and we have not made the change. And that's what we have to do. We have to think in a different way. We don't want to wait to that day when the doctor tells you you have cancer. I don't want to wait to the day where all of a sudden I fall down because I had a heart attack or a stroke. I don't want to wait for the day where I'm losing weight, feeling lousy, go to the doctor and they tell me you are diabetic. No. If we're approaching a new year, if we're approaching a new season, if we're approaching a new birthday, that's the time when I have to say, I'm going to switch. Period. This is history. This is the road I'm going to take from today on. Not patching, not fixing, not going around. No. Switch altogether your path. And there's where BioCare, there's where Dr. Rodrigo Rodriguez will be 100% behind you to help you make that switch that will help your life and the life of everybody around you. Let's keep on talking. I have some other good stories for you. My friends, I'm Dr. Rodrigo Rodriguez, Medical Director of BioCare Hospital. And today I've been talking about a switch of path. A switch of path to a healthier, to a better, more well-being by switching the way we live, by switching roads altogether. Stop doing what you're doing. Don't fix it. No, just switch. It's like when you live in a house, and I have seen TV shows about that, and probably you have to, when they're talking about an old house that has leakages and has short circuits and has basement problems and molds, and there's a point where people wonder, is it really worth fixing all this? Or I just move. I just move to a different house. And sometimes, you probably have seen it in these programs, they say, well, yeah, it can be fixed. And it can be fixed to a level where it's going to be satisfactory. Or when you say, it's too much money, it's too much effort, and you don't get what you wanted. If I move to a different house, I'm going to have the neighborhood, the space, the rooms, the nice environment that I'm longing for, or the garden or the pool, you name it. It's better to move. And that's what happens with our health. That's what happens with our lifestyles. There's a point where we have to decide if just trying to fix it will not do the job, and I'd rather switch everything. There's where BioCare has been working for many years. You know, sometimes I get a call from a patient, and the patient tells me, "Doctor, I have this problem, I have this other," and just by the conversation, I say, you don't have to tell me too much. I'd like to know what's your weight. And then they say, okay. They're hesitant because they know their weight is not what it should be. But we never put the two together. Or if we put them, we always disguise. We cheat ourselves. Yeah, I'm a little bit overweight, but it's not really important. It's not that much. I'm only 10%, whatever. You see, but it's not that what matters. I have always said it. If overweight would be a matter of looks and cosmetics, well, we just have to adjust to that. And we have to say, well, you're a little bit chubby, and you might still be, or you can be very good looking, actually. It has not to do anything with aesthetics. It has to do with health. If you have more weight than what you should, is that because of a metabolic problem that, number one, you're creating, number two, you can control, and nobody else? That's the important thing. I many times see people that look good, but when you check the blood work, well, you can see what's going on. You can see that heart risk markers are high, that inflammatory markers are high, that person might feel and look good, but it's going in the wrong direction. And that's the time when I'd like to intervene. That's the time when I'd like you to say, I'm going to pack and go to BioCare. In fact, that's what I do very frequently. When some of these people call me, I say, you know what, I'd like to see you at the hospital for, let's say, a week, for 10 days, for 2 weeks, because we can change it all. They say, doctor, but I'm not sick. In other words, we feel going to a hospital is a matter of sickness. Because we have grown to believe that if you have to have a surgery, if you broke a bone, if you're in a car accident, you should go to a hospital. But if I apparently well, why am I going to go to a hospital? Because you want to check everything. Remember the 50,000-mile checkup? That's what a very good friend of mine always talked about. There should be a point in our life when we stop and say, okay, let's check it all. Let's check the transmission, the oil pressure, the cooling system, the brakes, the tires, the etc., etc. I need a 50,000-mile checkup. And what a better place to do it than in a place that they understand what we're talking about. And that's BioCare Hospital. I'm going to go with you. I tell many of my people when I talk to them or when I have a consultation, I always say, to be treated by me, you have to bring your pajamas. In other words, if I find something abnormal, I'm not going to write a prescription, give it to you, go to the pharmacy, take it, come and see me in 2 months. I'm convinced that rarely works well. But if you come to the hospital and you learn what to do, and you get a kickstart on reprogram your body and your metabolic conditions and everything, then I know you're going to be successful. Only 2 days ago, I had a very successful businessman. He had COVID. Then he was going down. Then he was losing not his business, not his money, but he was losing the excitement of doing things. He talked to his children. He told them they should be getting ready to take over, not because he was going anywhere, but he didn't feel like going to work every day. He didn't feel like doing so many things every day, business meetings and luncheons and you know, the business person lifestyle. He didn't feel like it anymore, so they should be taking over. And it was one of his sons who contacted me. And I told him exactly that. I think I can help him. But I need him with his pajamas. If you want a prescription for an antidepressant, for any sort of drug, there are thousands of doctors that will be happy to take care of your father. But I think I know what he needs, but for that I need him for 10 days in his pajamas, because he's going to be in the hospital. He was so down, he didn't object to it. 3 days later, he was having a very active conversation. He had already lost 7 pounds. And he was not overweight. You know where those 7 pounds came from? From swelling, from water. And as the water left his body, the capacity, the efficiency of his heart improved. And as that heart function improved, so the kidney function. Because the kidneys are very dependent on the pressure of the blood going through those filters. That's what the kidneys are filters. That they need a minimum pressure to function well. So his body started getting rid of things it didn't need, getting rid of excess water, getting rid of a lot of things. Many of my patients, when they come to the hospital, they say, "Doctor, don't give me any more kidney pills or urine pills or whatever they call it." I say, "I'm not giving you anything. It's your body getting rid of what you do not need." Do you want to prove it? Take a day, 1 day off. 1 day you don't go to the office. 1 day you don't go to work. 1 day you don't have any appointment. And say, "I'm going to stay home and I'm going to eat only fresh fruit, fresh vegetables, just salads, 24 hours. No salt whatsoever, no sugar whatsoever, no sweets whatsoever, just fruits and veggies. I'm going to prepare a big salad and a big fruit salad. And I'm going to drink only tea. You can drink coffee, no sugar added, and you can, of course, drink all the water you want." You know what's going to happen? All of a sudden, you're going to start peeing. You go once, twice, 3 times, 4 times. You say, "Where is this water coming from?" That's water that has been accumulated in all your tissues. That's inflammation leaving your body. Do it. It only takes 24 hours. And you can prove to yourself that you can help yourself. And hopefully that will bring you to send me a note, to contact me, to say, "Doctor, I did it. It worked. What goes next?" Because the same way I go to the drugstore and buy a fancy cream to fix my face and look better, or a makeup, well, the same way I want to do something to improve my body. But something that's really substantial, something that's really good, lasting, and very efficient. So I would call Dr. Rodrigo Rodriguez and say, "Doctor, yeah, I want to take your challenge. I'm going to do a 24-hour challenge. Tell me exactly how." And 24 hours later, you're going to say, "I lost 2 pounds, I lost 3 pounds. No, you didn't lose weight. You lost accumulated water. And that water meant waste management. When we do not produce enough urine, we do not get rid of a lot of toxics. And it's not just a matter of drinking water. I hear it all the time. People tell me all the time, how many liters of water should I take? It doesn't matter, because you can drink the Hoover Dam, but on the other hand, you're eating a lot of bad fats and salt. That dam of water is going to stay in your body. That's what doesn't click in many people's mind. We're not steady. We're a very dynamic metabolic system. So I want you to stay where you are and listen to the next segment. I'm Dr. Rodrigo Rodriguez, and I have had a lot of fun, a lot of excitement talking about these subjects, about lifestyle, because it's a very dire need to change the way we live, because as we go, I see more and more people getting sick, and younger people getting sick. So it's not a matter of we are living longer. No, we're actually seeing younger people falling prey of chronic degenerative disease. And we're talking about how the body is a very dynamic system. What do you mean by that? We were talking about water. People tell you you have to drink so many quarts of water a day because blah, 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 blah. And it's not a matter, I was telling you, it's not a matter of how much water you drink. It's a matter of how you manage that water. So you can be drinking a lot of water, but then you have potato chips all day long, and French fries, and salt-loaded foods. You know where that water is going to go? To your very own systems. It's going to stay with you, because all that salt is going to draw that water in. And all those bad fats are going to make it possible, because they're going to create an inflammatory environment in your body. So you think you're doing great because you're drinking a lot of water? Think again. What else am I doing? Now, forget about how much water you drink. Stop salt. Stop bad foods. Stop bad oils. Start eating in a very healthy way. And you're going to start urinating. You're going to start losing weight. You're going to start losing a lot of this water that's swelling your organs, and you're going to be getting rid of a lot of the toxic things that are in your body. And you're going to feel better. Forget about what you drank. See how you're going to manage your water, because we're a body made in perfection. We're very dynamic. I'm going to give you another good example of how dynamic we are. I read frequently, or people ask me frequently, Doctor, I want to make my body alkaline. So I drink alkaline water. Well, we're not a test tube in the laboratory. If you have a test tube that's acid and you pour something alkaline in it, yes, it's going to neutralize it. But if your body is acid and you put an alkaline water in it, it's not going to do too much. Because the acidity in your body is not because your body is acid. It's because you're making it acid with everything you put in your mouth, with everything you do in your everyday life. If you smoke, your body is going to be very acid. If you have a 16-ounce steak, your body is going to be acid for the next 48 hours, because you cannot digest that amount of food. If you have bad oils, and bad oils can be anywhere, In your breakfast cereal, read the label. In your mayonnaise, in your salad dressing. You think you're healthy because you're having a salad. Yeah, but you're using a commercial salad dressing. Read the label and see the fats they use. Why? Because they're inexpensive. Whatever makes you think that the food industry is there to help you. It is there for profit. I don't have any problem with that, but I have my own choices. And you have BioCare, you have Dr. Rodriguez, who you can send a letter, who you can ask a question, who you can make a comment with, or even a conversation and say, Doctor, I'd like to do this, what else can I do? There's a very close person to me that doesn't live in the city where I live. I have a nephew that lives far away in Indiana. So I don't get to see him very frequently, but he follows some of the programs. And he follows some of the information that BioCare Hospital, and I would advise you to do it, frequently posts about food, about lifestyle, about exercise, about anti-inflammatories, about things you can do to sleep better, anything. You can go to BioCare Hospital website and you're going to find a lot of resources that you can start using today. Recipes, you name it. And if there's anything there that you don't see, feel free to say, well, I didn't see any recipe for matzo soup, for example. Right now, when we're going through Hanukkah, you might want to do some of those excellent Jewish cuisine dishes. Well, you can ask, and we'll give you a recipe for that. You see? So, every now and then you do this. And then this morning, this very same morning, my nephew, who's only 13 years old and who begins to like cooking, he asks me, Uncle, I have tried to do one of the dishes that you show on your website with broccoli. And yeah, it turned out to be good. My mother liked it, my brother liked it, my father liked it, so it was very good, a very good idea. But I have a question. What does broccoli have to do with cancer? I just cannot find the association. How come, if you eat broccoli, you can avoid cancer? And I said, okay, you have to follow my programs and I'm going to answer your question. So here it is. And it goes exactly with what I'm talking about. That our body is very dynamic. It has a lot of important metabolic changes that happen every day in every cell. Water, you don't put water and either stays there or goes out. No, it has to do with a lot of minerals, a lot with other substances, a lot with what is the status of our blood vessels, of our heart. So it is related to fats, to food, to weight, etc. It's very dynamic and it's very complex at the same time. That's why it works so perfectly. If it's very hot, for example, your body will demand more water because you're sweating, but you don't have to think of it. If it's very cold, you drink less water because you do not sweat. You're not losing water in your breath. Your body knows it's made with perfection. And the same could go to everything. Well, we humans have the capacity of keeping our temperature very well. We have a very steady temperature, whether it's snowing or whether we are on the beach. It's going to be very steady because we have a lot of systems that regulate the temperature of our body. And to do that, we have to burn fuel. We have a furnace. And that furnace is our mitochondria in every cell. But when we burn our carbs, we produce side products that are called free radicals. And like the exhaust of a car, they're not very harmless products. They could be damaging. So the body has a lot of systems to get rid of them. I watch on TV, same as with the alkaline water, same as the how many quarts of water you should drink, same as with everything. I have seen a lot of things that say, oh, this is an antioxidant. You have to take it because it is an antioxidant. And you say, what happens if I don't eat any antioxidant? Your body will make them. Actually, the body makes their antioxidants. And if you read anything, they're going to tell you that broccoli, and from now on, every time I say broccoli, I'm going to be talking about cruciferous, which is cauliflower, which is kale, which is arugula. It's not a lettuce. We have a salad of arugula. It's a cruciferous. It's Brussels sprouts. Okay, when we eat those things, you read and you see it, they tell you they're antioxidants. No, they're not. But they contain substances that are going to turn into an antioxidant. And that antioxidation is what's going to help we to stay away from cancer, because they also are anti-inflammatory. But it is because they have substances that your body will turn into the antioxidant you need. But it is our body that will produce the antioxidant. And one good way to start producing the antioxidant in broccoli and cruciferous in general is by destroying them mechanically. You have to crunch them, you have to break it. And as you can see, those veggies are very hard. So they demand a lot of chewing. So when you chew your kale, when you chew your broccoli, when you chew Brussels sprouts, you're doing the right thing. Now, remember that overheating those veggies is going to destroy the substances you eat them for. So be very gentle. The best way to do them always is steam them. Don't boil them. Always steam them. Gently, slowly, and if you can eat them raw, it's going to be fantastic. That's why kale is so good. Now, if you want to add, I'm going to give you a little tip. If you want to add to the antioxidant capacity of cruciferous, add mustard. But the real mustard, because the mustard seed has an enzyme that makes these antioxidants a lot more available to the body. We call about bioavailability. And if you have, for example, broccoli with mustard, you're going to multiply by 4. Interesting, right? So stay with me. We still have more to talk about. My friends, we have been talking about switching paths. Switching paths to a healthier path. To a different path that's going to take us to a healthier, longer, more enjoyable life. A path to well-being. That's what we have been talking about today. You are with Dr. Rodrigo Rodriguez, Medical Director of BioCare Hospital. And I love talking about this because it's been my quest, it's been my job, my idea to help you understand how important it is to have a healthy lifestyle, to honor thy body. You were given a body to be taken care of, not to be abused. We can certainly use it, and we use it in many ways. We run, we do our lives, we go to party, we dance, we sing, we dream, we travel, we get together with the people that we love. And nothing is more important. As years go by, you understand it more and more. Nothing is more important than your health. If you're healthy and strong, everything becomes very easy. If you're ill and weak, everything is impossible. Everything is a burden. But it is within our reach to change all that. That's why today I was talking about two cases. One of a 32-year-old gal who lost over 50 pounds in the course of a year just by changing the way she ate and her physical activity. And just, as she said, understanding that it was only her who could make the change. That no one else, the doctors, her mother, her family, no one else could help her. It was only her who could make the decision. And the other one is a 13-year-old boy that followed some of the recipes of BioCare website. And his question was very simple. Well, it was a good recipe, but what does that have to do with preventing cancer? And I hope I have given you some idea of why all of this is very important. There's a very good nutritionist, a doctor that I admire a lot, and she has always said, you can actually eat whatever you want, as long as you cook it from scratch. Because when we cook from scratch, we normally have a lot fresher local products. Because we're not using what's called convenience food. We're using the real thing. And by doing all that, temperatures, preservation, chemical additives, hormonal substances, antibiotics, etc., are all gone out of the picture. We might still have some problems, but that's not my objective today. Okay, I know about genetically modified foods, etc., but today we're talking about what's really within our reach, and it's cooking by ourselves. That's why I loved when I saw that a 13-year-old boy was following some of the recipes and actually asking a question. If I'm doing this, which is good, what does it have to do with cancer prevention? On the head of a 13-year-old boy, well, I thought we're doing the right thing. We're making people wonder, how can I really prevent? Why doing this is good? If we begin to wonder, if we begin to understand, if we begin to become aware of the dangers of not taking care of ourselves, we're going in the right direction. Because that's why BioCare Hospital, that's what our work has been for many years, and that's what I have learned and I have seen from many researchers in America, in Europe, in the Far East. Because many people are worried about that. Because we're seeing that younger people fall prey of deadly diseases. Diabetes is rampant, high blood pressure, and heart disease and strokes. Alzheimer It's the sixth cause of death in the United States. It was a virtually unknown disease when I was in medical school. So I'm not talking about 300 years ago. Heart attacks, allergies, 100 years ago, they were hardly mentioned in a medical book. And now we see them as we turn. If you go to the office, if you go to church, if you go to any place, and you ask, and then, oh, this one had cancer, this one had a stroke, oh, he's taking medication for diabetes, and so on. So we have to change all that. And to change all that is, let's switch. Now, if I know a doctor, if I know a place, if it costs me nothing to get more information, then my only prayer is follow that route, switch path. We're approaching a very important change of cycle. This is the time of new resolutions. From now on, I'm going to do this. From now on, I'm going to do that. But don't do it alone. You know, I have seen over the years that when you do it alone, it's a little bit harder than when you do it with somebody. So, if you have a family member that wants to follow through, make a team with your spouse, with your children, even if it's one child. And then you say, okay, let's talk about food. Let's begin cooking. Let's begin getting our hands dirty. Let's go to the kitchen. Because unfortunately, it takes a housewife to change things. And you know, housewives are a species in extinction. So what we're going to do from now on is to try to recuperate all that. Go to the kitchen and look at it on a different light, with a different perspective. And you have me, and you have BioCare Hospital, and you have BioCare doctors, and you have a BioCare kitchen, and you have BioCare cooks that do it every day, all the time, that will be happy to share experiences. You can also follow a lot of our previous patients. We have a lot of testimonials. So you can see for yourself that yes, you can gain years of life and you can add life to those years. If you can do that, if I can convince you to do that, you know what? The next year is going to be of celebration and happiness and travel. We're going to be together. We're going to enjoy each other. We're going to be very happy. And you will always have in me a very good friend. And I hope you're my friend too. So follow me, give me a like, do whatever. You show me you're there, show me you're with me. And let's go for one more year. Have a good one.